The TSWF workflow isn't just our AIM forms, but it's also how they get used by all the staff members in a clinic when documenting patient care. We'll start off with a quick peek of the Pediatric General AIM form, but then we'll spend some time going over the workflow before we get into the specifics about how and when to use each of the AIM forms in the Pediatric suite. Here's a picture of the first tab of the TSWF Pediatrics General AIM form. If you're used to using the Alta Medicine Treated document, then right off you'll notice that we are pushing more towards text entry now. We want notes to be legible, and the old style way of using checkboxes for everything didn't really lend itself to that. You'll also notice that we have a lot of patient history on the front of the AIM form. Although Alta makes a lot of this information available, it isn't always easy to view. We've set up our AIM form so that you can quickly get access to the patient's history right off the front page while you're writing your HPI. You should also notice that the past history text boxes are outlined in yellow. This information doesn't change very often, so we enter this information once and then carry it forward from note to note. We call this the copy forward process, and I'll have more details about it later on in the training. Last thing I'll point out before we start looking at the workflow. Although checkboxes are a bad way to document a history, they are the most efficient way to document several other parts of the note. Here we see the Physical Exam tab of the PEDS General AIM form, and it's mostly checkboxes. Now select handful of items also lend themselves to a checkbox type of question, and we see those scattered throughout the forms. We've tailored these forms to get the most comprehensive and legible note in the shortest amount of time possible. The TSWF workflow ideally starts even before the day of the visit. Our clinical support staff should look over each of the records for the next day. They open the encounter, and as long as the appointment isn't for today, it puts the record into an open not checked in status. Next, they'll copy forward the most recent documentation completed using the TSWF process. Now this could be from a different clinic or even another facility. If you don't pick the most recent one regardless of where it was from, you're going to lose any updates that have been made to any of the copy forward fields. Next, they'll review and update those copy forward fields, which can be done by reviewing the record. They'll look for recent hospitalizations, ER visits, and specialty visits that may not have been captured by the TSWF process. They'll look for needed preventive services and annotate those in the record. Now the exact things that they're expected to do in the process varies from clinic to clinic, so be sure to check to see what your facility wants you to do during this pre-visit review of the record. I'll have a link to the training on this process in just a little bit here. So now we're on the day of the visit. The patient checks in for the appointment and in many facilities is given an encounter worksheet to complete. This is a paper that mirrors the fields on the AIM form and allows the patient's parent to complete a lot of the questions while they're waiting to be brought back to the exam room. Your clinic will let you know if you'll be using these forms. Next, the clinical support staff will bring the patient back and open up today's encounter. They'll also copy forward the most previous note if it wasn't done on a previous day. This could happen, for example, if the parent calls for an appointment and is seen the same day. They'll perform the patient screening and document it in the record. They'll also confirm the copy forward information with the patient's parent, making any changes or updates as needed. The screening also includes documenting the chief complaint and entering in a few details about the HPI. Your clinic will let you know how detailed you should be when you're entering in the HPI. Now, even though we have a lot of information on the AIM form, it isn't where everything is documented. Vitals still get documented in the Vitals module, and allergies get verified in the Allergies module. When the provider goes into the encounter for the first time, they should take over the note and not create a new one. This makes it much easier to make edits to the information that the clinical support staff has entered in. The provider then completes their documentation and signs the note. With that introduction to the workflow out of the way, it's time to look more at the individual forms and when you should use each one in the Pediatric suite. There are 4 different forms that make up the Pediatric AIM form suite. The first one should be used for all visits for infants and toddlers up to 23 months of age, regardless of what they're being seen for. We have several history and exam elements on this form that we don't have on any of our other forms. These next 2 are for children from 2 to 6 and for children from 7 to 18 years of age. Although these could be used for all visits for children in these age ranges, they were designed specifically to be used for well child checks. If a child age 2 and older is being seen for anything besides a well child check, we have a Pediatric General AIM form that works best for that. So to review, the 0 to 23 month form should be used for all well and acute visits for kids in those ages. The 2 to 6 and 7 to 18 are for well child checks, and the general form is for all other routine and acute visits for kids 2 and older. Let's go over some basics that apply to all our AIM forms. You'll see at the top of the first tab we have some information in a big red box. We use this to call out information to you. Right now it's Ebola screening, which is a hot topic, but it does change from time to time. There's a lot of free text that goes into our notes. You'll notice at the top left of every free text area there's a checkbox. If you uncheck one of these checked boxes like we are doing here at the current meds, you'll see that it resets it to the default text that is there on a new form. Sometimes you'll want to do this, and we'll show you that in the screening module. But if you accidentally uncheck something that was there, you can go up to this undo button, click on that, and it'll bring the text back to what it was. Now, if you're typing in one of these free text areas and you need to get a new line, you can't just press enter like you would in a Word document. Instead, you have to hold down the control key and hit enter to make it go down to the next line. However, if you don't want to do that, you can double click inside one of these free text areas and that'll bring up what we call the typewriter window, and in there you can type and press enter just like normal. And then when you get done with your typing and click OK, you will notice that you don't see those carriage returns within the box, but if you were to leave the module and come back, you would see that those little tilde characters turn back into carriage returns, so it will look like you expect in your note. On each of our forms, you'll see a fair number of buttons. These buttons mostly bring up web-based resources that could be helpful to you when you're seeing patients. For example, here I'm bringing up the CDC's webpage for immunizations, so if I have a question about immunizations, I can go straight to the source from within ALTA. Another thing you'll see frequently on our forms are these square buttons with a couple of greater than signs. If you click on one of those, it'll expand what we call a ribbon. A ribbon is a way of hiding some of the text on a form so it's not showing up all the time. In this case, I'm using it to bring up items on the musculoskeletal tabs. There are some instances where this will open up automatically, depending on how you answer certain questions. There are several instances of this on the Screening tab, like the tobacco questions and the PHQ-2 screening. Another thing you'll see commonly are these buttons that say All Negative or Normal. What these do is answer all the questions as normal within a box on the form. In this case, I have clicked on Normal for the ears physical exam section, and it set everything to be a normal exam. Now, if you didn't mean to click on that, and some of these do answer quite a few questions, you can go up to the Undo button and reset all of the questions. Also, I should remind you that you should uncheck anything in particular that you didn't actually ask or examine in whatever sections have these buttons. Last thing I'll say about AIM form basics deals with copying things forward. If you're not at all familiar with the TSWF copy forward process, click on the blue button to get familiar with that functionality. But we need to stress just a few quick things about the process. First, you shouldn't uncheck any copy forwarded fields from a previous note. Now, you may not want to see all these things in your note, for example, maybe preventive services if you're just doing an acute visit. But if you leave it out, then other team members will have to enter in that data all over again. However, that doesn't mean you need to leave all the default text in these copy forward fields. For example, the preventive services field has a text for a newborn screen. Well, that's probably not so important for a child that starts coming to your clinic at age 5, so you can delete that line in the note. In fact, you could edit it so that it has very little resemblance to what you see as the default. The main thing is that everyone in a clinic should be doing the same thing. I do want to mention one bit of text that you should never delete. That's the Note Accomplished in TSWF text in the HPI box. That's the text you look for the next time it comes to copy forward an old note. If you delete that, then any updates you make to any of the other copy forward fields won't carry forward to the next encounter. The clinical support staff should start filling in this section below the note completed in TSWF text according to their skill level and what your clinic wants them to do. And as a final reminder, when you do copy forward, pick the most recent note, no matter which clinic it came from. Let's now talk specifically about what the clinical support staff will do when screening the patient in the ideal workflow. Now, this is just an example, and your clinic may do things a little differently. Follow your local protocol if it differs from what you're seeing here. There are 4 forms in the Pediatrics suite, and I'll start off by showing you what you'll see in the Peds General form, and then we'll explore how some of the age-specific ones differ from it. When using the Pediatric General form, most of the screening is primarily done on the Screening tab, but there are just a few fields to answer on the HPI tab, so we'll look at those first. The chief complaint, HPI, and other current history fields should be completed according to your clinic policy. Medication compliance is appropriate if the patient is taking any medications, but don't check the medication reconciliation boxes, as those are for the provider to use. Review all the fields that have data that's copied forward. If you're seeing an adolescent who has started her periods, the female maturation ribbon also has several copy forward fields on the first ribbon that you should be answering. With that out of the way, we'll switch over to the Screening tab, which is where most of the screening questions are located. Currently, the form starts off with some Ebola screening questions. Your local facility will give you some direction on when these should be completed. The ribbons will automatically open up if you say yes on any of these. You can also open the ribbons themselves if you're interested in seeing what they say. Next comes a number of items that are more appropriate for general wellness visits than most acute visits. However, we don't want this data to disappear out of the note, so it's located here to be reviewed if necessary. 2 that are important to review every time are the preventive service recommendations and the immunization status. Scrolling down, we see questions for tobacco screening, which should be asked of all patients starting at age 11. If the answer is yes, additional questions open up for you to document in. Following this, we have questions dealing with fluoride, TB, and lead screening. Once again, complete these according to your clinic policy. Depression screening is next, and the following 2 questions should be asked of all patients starting at age 12. First, do you have little interest or pleasure in doing things? And 2, are you feeling down, depressed, irritable, or hopeless? If the answer is 2 or higher on either of these questions, then the screen is positive and you should ask the full 13 questions of the PHQ-9 adolescent and document the score. By the way, it's important to ask the questions exactly as you see them written on the screen for the results to be valid. And if it is positive, make sure to inform the provider before they go in to see the patient. We finish up the screening with the annual questions. These are all mandated by one of the accreditation agencies that inspect our facilities. The annual questions get asked, well, you guessed it, annually for each patient. Make sure to put the full date at the top so you can tell if it's been more than a year since they were last asked. If it's been more than a year, then we want you to reset these questions since they do change from time to time. You do that by unclicking the red X and then start answering the new questions. So that's the general form. How does this vary if you're using one of the age-specific forms? Well, let's look at the 0 to 23 month form to see how it differs. The chief complaint and HPI sections is the same for this form on the first tab. But you'll notice that several copy forward fields that were on the Screening tab on the general form are now front and center on this form. These are the kinds of things that would normally be asked at a well child visit, so it makes more sense to place them here on the front tab. And some of these questions are age specific. For example, we only have the birth history on the 0 to 23 month form. We see several other examples of age-specific questions on the Screening tab. For example, we don't ask a lot about personal habits in the 0 to 23 month form. But in the other 2 age-specific ones, we do start to get into things appropriate for those ages, such as exercise habits and TV and computer time. In the 7 to 18 age form, we also ask about tobacco use, but you shouldn't start asking that routinely until age 11. The PHQ-9 adolescent screen also doesn't show up until you get to the 7 to 18 age form. Now, depending on your clinic, either the clinical support staff or the provider might be responsible for completing the ROS section. I'll go ahead and cover that now. If you're a support staff person and you don't understand some of the terms, ask your provider. The ROS is found on the bottom of the first tab of the general form and on a tab by itself on the age-specific forms. We're looking at the pediatric general form right now. Now, first off, we have placed a quick review of systems covering many common pediatric symptoms in the top left gray box. Like we've shown before, you can click on the All Normal button to answer them all. Next, to the right of each term is a button that will say either ROS, like you see here, or HPI. That determines where in the final note these different elements will go. We recommend leaving this as ROS the majority of the time. To the right of the ROS button is a button with a square in it. That's an area where you can add free text to expound upon an entry if needed. And once there is text in that box, you'll see the box change like the one next to the pulling at ears term. By clicking on this button, you can see what was written and either add, edit, or delete the text as appropriate. Also, on several of the ROS sections, we have some visit-specific ROS lists. Here on the general form, you can see that we have ones for asthma, ADHD, and a few others. These can be used in addition to the quick ROS box. And here on the pediatric 0 to 23 month form, you can see that we have the ROS on a tab by itself as opposed to being at the bottom of the HPI tab. In this case, we also have only one visit-specific ROS, and that's for viral symptoms. On the other age-specific forms, there are a few different ones to help you out when you're seeing these patients. With all of that out of the way, let's start focusing a little more on the provider responsibilities. First off, the medical assistants may fill out some of the details like the chief complaint in the HPI, but it's the provider's responsibility to make sure it's correct. We mentioned this before, but please don't delete the Note Accomplished in TSWF text you see in the HPI box. If you do, then any updates to the copy forward areas won't carry through to the next encounter. You'll start to type your HPI below this prepositioned text, leaving a blank line between the text that's there and your note. This really helps to make this text stand out when you're quickly looking through previous encounters. One other important area I want to point out on this page. Below the medication list are several boxes that deal with both medication compliance and reconciliation. Medication compliance is done at the beginning of the visit and can be completed by anyone. It tells us if the patient is taking their prescribed medications the way we expect them to. This is different than medication reconciliation, which is done at the end of the visit and should only be done by the provider. Medication reconciliation is where we review all the orders a patient has and make sure they are aware of how to take all their medications, including any new ones. Like the clinical cue says next to these boxes, we expect this to be done only by the provider. Next, I'll cover physical exams. There's a few differences between the different forms. I'll start off by looking at the Pediatrics General form, and on there, the main physical exam tab is the one labeled PE, so I'll start there. First off, just like in several other areas, there are buttons you can press to automatically select the normal findings for a particular body area. However, any text that's in gold isn't selected by this normal button. We didn't feel like these were done commonly enough to warrant always being selected, but they are easy enough to add just by clicking on the checkbox. If you want to document something that doesn't exist on the form, you have a couple of choices of what to do. First, you could just type the findings in the general free text box here at the top right of the screen. Or you could click the free text button next to the body area name to associate it with that body area. Finally, if you click the down arrow next to that box, it will bring up the full medicine tree for that particular area. Here I've selected lungs, and it's brought up the lung medicine tree for me. By the way, you can close this tree by clicking on the Close Trees button. If you document that something is abnormal, frequently that needs explaining as to how it was abnormal. You can add free text to any of the exam findings by clicking on the free text box next to it like we've highlighted here. Now this main exam tab doesn't cover any musculoskeletal exams. Those are found on the MSK Up and MSK Low tabs on the general form. I've got the upper musculoskeletal tab on the screen now. Each individual area is in its own ribbon. I've expanded the wrist ribbon, and you can see we've separated out the left and right sides and given you a normal button to quickly document normal exams. So that's the physical exam on the general form. Let's pull up the 0 to 23 month form to see the differences. On this form, we have a few exam elements that don't exist elsewhere. For example, we have 2 different head exams which help you to document the Fontanelle exam when appropriate. We also have 2 different hip exams depending on the age of the patient you're seeing. There are a few other small differences between the physical exams on the different age range forms. For example, the Tanner stages are only available on the 7 to 18 year form. Take some time to familiarize yourself with the differences when you start using our suite of forms. On each of our forms, there's a tab for developmental screening. The specifics vary from form to form. For example, on the general form, we have the HEADS assessment tool. If you have the form open when you're seeing your adolescent patients, this can help you to remember what types of questions you should be asking to complete this assessment. We also have the same information on the 7 to 18 year form. For our younger patients, we have made it easier to document many types of developmental screening. Here we have the 0 to 23 month form open to the Development tab. At the top of the page, we've given you a place to document the MChat, as well as given some basic details about scoring and a link to take you to more detailed information. For the rest of the developmental screening, we give you 2 different options. If your clinic uses the Ages and Stages questionnaire, the results get documented right below the MChat text box. Otherwise, you would use one of the age-specific developmental sections below. Now you can see there's 2 columns. You should either use the free text area on the left side or the alternate checkbox area on the right. You would never use both of these in the same note. And our recommendation is to use the free text boxes on the left-hand side because we think they look a little bit better in your final note. Now, if anything is abnormal, you would select the abnormal checkbox and then change the Y to an N for the corresponding finding. Otherwise, just select normal and you can leave all the preposition text as it is. Each of the age-specific forms has the American Academy of Pediatrics suggested topics for age-appropriate anticipatory guidance that you can use when discussing these topics with your well-child checks. I've expanded the one for children ages 9 to 10 just to give you an example of what it looks like. And if your clinic uses age-specific handouts to give to the patient, there's a simple checkbox at the top you can use to document that in the record as well. Alright, one last tab to talk about, and that's the Chronic Conditions tab, which is found on all our forms, although the conditions listed do vary from form to form. Right now I've got the 7 to 18 year form pulled up. At the top is a section where you can document details about any chronic condition that you may need to track over time. Following that, we have several disease-specific sections. On this form, we have asthma, ADHD, and diabetes. I've opened up the asthma one just to give you an idea of the kinds of things we've included in these areas. The majority of this is in yellow, meaning it's historical information that'll be copied forward from encounter to encounter. There are also links off to the side for information about the Asthma Action Plan and the Asthma Control Test. If we look at the ADHD ribbon, we'll see that there is more information about how the child is doing right now, which doesn't copy forward from encounter to encounter. You would use these areas in addition to the HPI on the front tab to document these visits on your patients. So that's our review of the Pediatric suite of AIM forms and their associated workflow. The most important part of the workflow is that everybody on the team performs things the same way. You should check around with your clinic and see how they expect you to complete things and if there are any local variations to what we have shown you here. If you have any questions about any of our forms or the associated workflow, your first point of contact should be your local clinical systems trainer. However, you can also get a hold of the TSWF team through this link on the front tab of any of our forms. This will take you to Mill Suite, where we actively monitor message boards for your input and feedback. Let's talk a little bit about some of the options you should set in Alta to help maximize your performance. To do this, you need to be inside of an encounter. You can't do this from the appointment list. Once you're inside an encounter, click on Options to bring up the Encounter Summary Properties window. Of course, if you haven't set your signature block, go ahead and change lines 2 and 3 to be what's appropriate for you. If it says Physician/Workstation, that's the default, and make sure you change that. Underneath that, we see the auto site preferences. Now this is important. The only thing you should have set under here is allergies. If you auto-cite active medications and problems, you'll frequently see a conflict between what's in these lists and what we're storing on our AIM forms, and we don't want to see that disconnect between the two, so go ahead and uncheck those and only have allergies checked. Next section down, you certainly can check to see whether you're going to auto-cite automatically recent labs, vitals, and RADs. However, you can also bring them over individually, and that's actually a much better thing to do, so we recommend unchecking all these. That's different than the AP Active Order default that we recommend keeping all these checked, unless you're at a site where having them checked really slows down the performance of the AP module. Your clinical systems trainers can give you more details about that. Under SO default, I recommend unchecking both of these. These made a lot more sense in one of the older ways that we used to teach how to document. However, having these checked doesn't work real well when we're using any of our Tri-Service Workflow AIM forms. The last thing to look at is some of the boxes on the bottom. If you want, you can include the codes within the encounters themselves from this checkbox. This just puts them on the printed note. If you're curious about the Warn Me If No Procedure documented, that was designed for specialists that don't really use E&M codes but always use CPT codes to document the work that they're doing. And then we recommend to uncheck the autosave button. This used to be helpful when Alta had issues staying connected, but Alta's pretty darn stable these days, and every time it autosaves, it freezes up your system for several seconds, and so we actually just recommend unchecking this. When you're all done, click OK, and then it's all set.